In less than 30 minutes, we'll tackle 7 real exam-style questions, complete with rationales and strategies to boost your test prep. Think of me as your NCLEX guide. This isn't about memorizing facts. It's about mastering critical thinking and connecting textbook knowledge to real-life nursing. When a question pops up, pause the video, read it out loud, and explain your reasoning, even if it's just to your dog or your reflection. Ready? Let's do this. First up, imagine you're prepping Mr. Henderson for an MRI. He's wearing a wedding ring and a watch and asks if he can keep his dentures in. The NCLEX asks, what's the most critical instruction before an MRI? Options: A, hold your breath. B, drink fluids after. C, no metal objects. D, the machine will be silent. Pause and think. What's the biggest safety risk here? Option A is for X-rays or CTs, not MRIs. B is for contrast dye, not the main concern here. D is just wrong. MRIs are loud. The answer is C, no metal objects in the MRI room. The MRI is a giant magnet. Any metal can become a dangerous projectile. Even small jewelry or implants can cause serious harm. Always screen for metal jewelry, implants, even tattoos with metallic ink. This is about preventing catastrophic injury, not just image quality. Safety is your top priority. Never send a patient with metal into an MRI. That's the kind of critical thinking that NCLEX wants. Identify the biggest, most immediate threat. In this case, it's metal in the MRI room. Always think safety first. Next, pharmacology. You're giving Digoxin to Mrs. Johnson, whose potassium is 2.9 micrel. The NCLEX asks, what's your priority? A, give Digoxin. B, hold and notify provider. C, give potassium, then Digoxin. D, document and recheck in 4 hours. Pause and consider what's the danger here. Option A, never give Digoxin with low potassium. That's a recipe for toxicity. Option C, don't give potassium without an order, and it won't fix the problem instantly. Option D, documenting is not an action, and waiting is dangerous. The answer is B, hold the Digoxin and notify the provider. Low potassium increases the risk of Digoxin toxicity. Think arrhythmias, nausea, vision changes. Your job is to prevent harm. Hold the medication, call the provider. Hypokalemia and Digoxin are a dangerous combo. Normal potassium is 3.5, 5.0 mql. Always check labs before giving meds like Digoxin. If something's off, act, don't just document. You're the last line of defense. Hold the medication, escalate the issue. That's safe nursing. Infection control time. A patient has a cough, fever, night sweats, and a positive TB test. The NCLEX asks, what isolation precautions? A, contact. B, droplet. C, airborne. D, standard. Pause and think. How does TB spread? Standard precautions are for everyone, but not enough for TB. Contact is for things like MRSA or C. Diff. TB isn't spread by touch. Droplet is for larger particles. Think flu or meningitis. TB is airborne, tiny particles that float in the air for hours. The answer is C, airborne precautions. Place the patient in a negative pressure room. Anyone entering wears an N95 respirator. Airborne particles travel farther and linger longer than droplets. This is why TB is so contagious. Know the difference between droplet and airborne. NCLEX loves this. Airborne, gas, N95 mask, and negative pressure room. Protect yourself and others. That's Infection Control 101. Let's talk diet and meds. You're teaching a patient on Warfarin about food interactions. The NCLEX asks, Which food, if eaten inconsistently in large amounts, could decrease warfarin's effectiveness? A. Oranges. B. Broccoli. C. White rice. D. Chicken breast. Pause. What's warfarin's nemesis? Oranges. Vitamin C, not a problem. Rice and chicken, no effect. The answer, B. Broccoli. Broccoli and leafy greens are high in vitamin K. Warfarin works by blocking vitamin K-dependent clotting factors. Sudden increases in vitamin K can make warfarin less effective. The key is consistency. Don't suddenly change your intake of vitamin K foods. Patients don't have to avoid greens, just keep intake steady. Teach patients sudden diet changes can mess with their INR. Consistency is crucial for safe anticoagulation. Vitamin K and warfarin are always in a tug of war. That's the teaching point. Emergency time, you find a patient unresponsive, breathing 6 times per minute with pinpoint pupils after IV morphine. The NCLEX asks, what's your priority? A. Chest compressions. B. Naloxone. C. NG tube. D. Check glucose. Pause. What's the immediate threat? Chest compressions are for no pulse. This patient is breathing, just not enough. NG tube is irrelevant. This was IV, not oral. Checking glucose is good, but not the priority here. The answer, B. Administer naloxone. Naloxone, Narcan, reverses opioid overdose by kicking morphine off the receptors. The ABCs. Breathing is compromised. Fix it fast. Give naloxone. Support breathing. Call for help. Opioid overdose. Respiratory depression. Naloxone is the antidote. Act quickly. Seconds count. Know your emergency meds and when to use them. Save the patient's life. Administer naloxone. That's rapid response nursing. Pharmacology again. A patient on lisinopril for a month reports a persistent dry cough. The NCLEX asks, what's the likely cause? A. Serious allergic reaction. B. Common side effect. C. Probably a cold. D. Take with food. Pause. What's unique about ACE inhibitors? A dry cough is a classic side effect, not an allergy, not a cold, and food doesn't matter. The answer, B, it's a common side effect. Notify the provider. ACE inhibitors like lisinopril increase bradykinin, which causes a cough. It's annoying, not dangerous, but often leads to switching meds. Angioedema is the serious allergic reaction. Watch for swelling, not cough. Always listen to your patient's concerns. Educate. This is a known side effect, and the provider can switch to an alternative medication if needed. Knowing drug side effects helps you advocate for your patient. Don't dismiss symptoms, investigate and educate. ACE inhibitor cough is a top NCLEX favorite. Recognize, validate, unesca, escalate as needed. That's safe, patient-centered care. Last one, a child with asthma gets albuterol. 10 minutes later, you reassess. The NCLEX asks what shows the med worked. A. Increased heart rate. B. Decreased wheezing. C. Feeling shaky. D. Lower blood pressure. Pause. What's albuterol's goal? Increased heart rate and shakiness are side effects, not the goal. Lower blood pressure isn't the main concern in asthma. The answer, B. Decreased wheezing. Albuterol is a bronchodilator. It opens airways. Less wheezing means better airflow and effective treatment. Always assess for therapeutic effect, not just side effects. Improved oxygen, easier breathing, and less wheezing, psych success. NCLEX wants you to know the difference. Focus on the primary problem, bronchoconstriction. Listen for improvement after treatment. That's how you know you made a difference. We did it 7 questions down. NCLEX success is about prioritizing ABCs, eliminating distractors, and understanding the rationale behind every answer. Don't just memorize, connect the why to your actions. Start studying early, practice daily, and use a good question bank. Always read rationales, even for questions you get right. Build your confidence and clinical judgment with every question. You're ready for this? Believe in yourself. If you find value in this video, please subscribe to our channel. Download your free Ultimate NCLEX Study Guide from nursecareerblueprint.com. Now go be awesome, and I'll see you in the next video.